Hi, I'm Marie Hopkinson, and today I'm going to talk to you about acupuncture and dry needling. What is the difference between the two? How can you make a better, more informed decision about your treatment? I've got a much longer video on this, so I encourage you to click the link in the description below. But this is just a really quick overview. So really the point is acupuncture is not dry needling. Dry needling is not acupuncture. Can an acupuncturist do dry needling? Yes, they can. Can a dry needling person do acupuncture? No, they cannot. Unless they're trained as an acupuncturist, unless they're trained in Chinese medicine. The short story of the long version is that acupuncture is based on a history that has been time tested, more than 2,000 years of history on it, and you'll see like in the longer video that I go through all the different aspects of what it makes a Chinese medicine practitioner, what makes an acupuncturist know all these things. One of the aspects is all the knowledge that they have about the system of Chinese medicine, which is completely different to Western medicine. Now, an acupuncturist does learn the system of Western medicine as well, and they certainly can use that framework to treat you. So if a patient comes in with back pain, as an acupuncturist, I may use aspects of dry needling on them, which means I may palpate their muscle, and I may find trigger points and sore points and know the structure of that muscle, the origin, the insertion, that kind of thing, and know that muscle is tight and we want to release that muscle. And in order to do that, certain points within that muscle that are tight or trigger point based could be used. So certainly some acupuncturists like myself, or there's tons of other people that other acupuncturists that would use their acupuncture needling in this way. Before dry needling was used as a common phrase, I never used to use that phrase. We would call it a very similar thing to Asher point needling, and maybe just adding that extra knowledge of musculoskeletal anatomy onto that. One thing that really bugs me about when I'm Googling this is that obviously acupuncture is more well known than dry needling, and some patients come into me and say, I had some treatment for my shoulder already, and when you question them about like they said, acupuncture treatment, it was a physio they went to, or a massage therapist or something like that had given them dry needling, actually not acupuncture, and the treatment hadn't worked very well, and so the patients then put two and two together saying, well, I've used acupuncture for this and it hasn't helped. And so it's a misleading thing for a dry needling practitioner to say to a patient, you've had acupuncture, when they really haven't. And another thing that really bugs me about it is seeing that this idea of misleading people into this concept that dry needling is more scientific than acupuncture is. One website I saw had something like, dry needling is based on Western scientific methodology, and acupuncture is based on like meridians and qi. And just leaving it at that and making it sound like, well, Chinese medicine is just woo-woo, and it's mystical forces and things like that, which is totally not true. And if they actually took the time to understand that, which just takes a lot of headspace to understand what do those words mean, that the concept of qi is not like a mystical force of energy. Like some translations of qi can just simply be air in your body. It's the force of the movement of things in your body, and there's a lot of texts that talk about using acupuncture in terms of moving the blood and getting blood flow to different areas of your body. It's got nothing to do with some mystical force. So that is annoying to me, and I just wanted to make this video to kind of put that out there and debunk some of those myths. I mean, the other thing is just making it seem that Chinese medicine is unscientific is a total I think it's a crime against science, because if you look up the definition of science, it's here we go, from Google, the definition: then the intellectual and practical activity encompassing the systematic study of the structure and behavior of the physical and natural world through observation and experiment. Well, what isn't observational about 2,000 years of history and having those textbooks and having practitioners who are dedicated to studying that and observing and experimenting and documenting that and utilizing that information? Has been a lot more longer used than some things that are modern techniques that are so-called higher in a hierarchy of evidence. Anyway, I don't want to get to a rant about like that, because I might get a bit more angrier. But you get the gist that, it's misleading for people that maybe like yourself that are looking for the treatment that's going to be right for you. You want to make an informed decision, and then to go onto a website, it's basically saying, well, dry needling is more scientific than Chinese medicine or than acupuncture is. Well, sorry, but dry needling hasn't been around that long. It's only been around, you're comparing something that's been around since maybe the earliest use was in the 1940s, and something that's been around since the Han Dynasty, which is more than 2,000 years old. Well, there's not really any comparison there in historical use and documenting, and the number of patients and the people that have used it over those years. Just that time-testedness is going to have to tell you something about its efficacy and also about its safety. Let's not just get onto the safety of dry needling versus going to see an acupuncturist. Dry needling in itself isn't an unsafe practice. It's just that there's a less regulation around dry needling. I'm not sure if you're aware, I'm from Australia. We have regulation for acupuncture, as in acupuncturists and Chinese herbalists, and also Chinese medicine practitioner. That those titles cannot be used by someone who's not been registered, but it doesn't mean that a person cannot use those the word acupuncture to say that that's what they do. Also, if you're another registered profession, so for instance a physio or a GP, you can have those professions allow their members to have their own level of standard of training. So for instance, an acupuncturist in Australia has to train for 4 years as a minimum before they're allowed to go and practice on patients. So they have to do 4 years of university training, including like lots and lots of practical treatments on patients, clinical hours, and then they're allowed to go out and practice. Whereas a physiotherapist, they've done 4 or 5 years of study, not in Chinese medicine or acupuncture, not in actually needling patients. The majority of physiotherapy, and up until like 2006 when they amended the Physiotherapy Act, they weren't actually even allowed to penetrate the skin. They weren't supposed to be penetrating the skin. Now that law has been changed, but what I'm getting at is that like a lot of practitioners in those professions go and do an additional course, and that's endorsed by those associations to say that that's a sufficient amount of training. Well, what I'm saying is, it might be deemed as a sufficient amount of training, but it's not the same as seeing an acupuncturist. So please, if you're a person who's considering having acupuncture as a treatment, don't just go along with what your practitioner is saying. If they're not a Chinese medicine practitioner, if they're not an acupuncturist, you don't just take it and think, oh, this is what I have to have, because there may be a better practitioner that's out there that's actually more skilled in giving you acupuncture than a person who's doing chiropractic or physio or something else. I'm not having a go at those professions. They're great professions, but if they were so great at what they did, why are they sticking their nose into acupuncture and trying to use acupuncture and dry needling? Like, why don't you just stick to physiotherapy or chiropractic and use those methods? Like, I don't know, like, stick to your own area. So the purpose of this video is to really just inform you and to make sure that you understand that there is a difference between acupuncture and dry needling, and that you can use this knowledge to make a better decision, hopefully, to know what's the best thing for you to do in your situation. Thanks for watching.